Scott Roeder, was nowhere near that level of association between Christianity and terrorism. You can take a very close look at these two separate incidents. Way less attention to Christian violence undertaken in the name of religion and God. Much more attention to this idea that there's something inherently connecting between Muslim and terror. So this is very interesting. Now, people might say, well, you know, this is something that's to be expected because in the American mind, people think of Islamic fundamentalism and they think of 9/11. Well, people throughout the rest of the world look at it the other way as well. They think, they look at the Bush administration and they look at American popular culture and they say, what is going on in this country? Much of the rhetoric is inherently loaded to appear like it's blatantly prejudiced against Islam and Muslims. You have George W. Bush right after 9/11 who says we're going to be engaged in a crusade. He immediately corrects himself because he realizes he really stepped in a big pile of mess there. But he continues to use the binary language. And this has been documented in entire scholarly books. Good versus evil. Constant discussion of how God's on his side in the war on terrorism. Many times this is declared publicly after the Crusade comments. You have the Rumsfeld. I'm sorry, I said Dumsfeld. That was a slip. I meant Rumsfeld. I don't believe in that kind of silly name calling. But Rumsfeld's daily briefings. He was giving briefings to George W. Bush on the progress of the Iraq War, regularly accompanied by Bible verses. This is the inside language of the Bush administration at the time. You have the Abu Ghraib prison, blatant racism and abuses. The idea from interrogators who are engaged in these abuses on the ground is, well, you know, it's okay. We get intelligence by beating Arabs and Muslims, by hooding them, by making them strip down naked, because these things are embarrassing to the Muslims. You know, having these dogs out there barking at them and biting them. Making them strip down naked and form big naked man piles, as we've seen. These things are embarrassing to the Muslims, as if nobody would be embarrassed if you made them strip down naked and form a naked man pile, or had to be barked at by dogs. So we have all these types of examples. We have the ground zero fundamentalism now, this idea that all of Islam is one monolithic thread and it's terrorism. So why is it any surprise? People throughout the rest of the world look the same way at the United States when we talk about this idea of a culture war. So I don't think it's an unfair analogy to say that there's something special, right? I think there's not something special when you talk about Christian terror versus Muslim terror. It's a way that we want to look at ourselves compared to the rest of the world and think that we're special and unique. It happens quite often. What are the effects of this kind of media coverage? Well, if you take a look very closely at public opinion, you'll see that the people who have the most racist opinions and the most misinformed opinions about Islam, where are they getting their information from? They're getting their information from a number of ways. One is passive and two are active. The passive one is just lack of education. They don't have access to educational opportunities, or they didn't engage in them. So they didn't go to, let's say, an educational setting, let's say, for example, a higher education, where presumably you would study an issue like Islam in some sort of religious context or some sort of foreign policy class and learn basic tenets of Islam, which we apparently don't teach, or at least a lot of people don't get access to them. But if you went into this kind of setting, presumably you would get access, because people who have higher education are systematically less likely to have these kinds of racist views against Islam and misconceptions. There's two other active forces going on here in terms of promoting misconceptions and racism. One is not knowing someone who's Muslim. If you don't know somebody who's Muslim in this country, you're likely to believe all of the worst stereotypes, or at least you're far more likely. And the final one we can all guess because it's the topic here. Where do you get your information from? Mass media. People who say they get their information about Islam from the mass media are far more likely to have these kinds of racist misconceptions. So this is an important point to stress. You have media-induced ignorance in this case. It's been understood for a very long time. People like Edward Said and many, many others have documented it. But now we can actually show it empirically in terms of the effects. We can show very clearly that the more you watch in regards to Islam, the less you actually know, the more racist and intolerant you are. That's one example. We can go over many, many examples. I mentioned a bunch at the beginning of this discussion. What hopefully will be discussion soon. Healthcare, global warming, Iran, Iraq, Afghanistan, Islam. I want to talk about healthcare for a little bit before we open up for discussion. I've done a very systematic analysis of this. It's coming out in my Tea Party book in next spring for Paradigm. But what you actually see if you look very closely at the media coverage of healthcare, you see an increasing dominance of the messages that were disseminated by media, by right-wing views. You can even count this quantitatively, as I've done in this book. It's very clear you see these trends. What are the dominant trends I'm talking about when you look at media images and themes? Number one, this was the most popular one in terms of media coverage. You can chronicle it across the New York Times, the Washington Post, Fox News, MSNBC. Doesn't matter if you go to the most liberal or the most conservative of mainstream mass media outlets. Unsustainable cost. This is going to cost too much money. So we have this kind of discussion. No one talks about foreign wars and how much those are going to cost and whether that's unsustainable. But healthcare is. Providing healthcare to poor and disadvantaged Americans is unsustainable. A huge theme is this discussion of this alleged grassroots uprising with the Tea Party and all the messages that come along with it. And by the way, the big message of the Tea Party is cost. We hear it over and over and over. I've said it on many of their meetings. Unsustainable spending, reckless spending, unsustainable deficits. What other themes are the dominant themes? Death panels. This is a huge one in late 2009. Obama as the socialist, Marxist, big government proponent. More conflation here. There's apparently no difference between big government and Marxism. There's a huge difference if you know anything about Marxism. You can have big government and have universal health care, and it's not the same thing as Marxism. You wouldn't know this by listening to Glenn Beck and listening to right-wing radio and television. And of course our favorite, which is rationing. That goes right along with death panels. These are not just issues that are pushed by conservative media. There's this idea in media studies, it's called agenda setting. If you can control what is being talked about, you can control what people think about it. It doesn't matter if people dispute the claim that death panels are there or not. Because at the end of the day, the discussion is still about whether Barack Obama wants to kill your grandmother or not. It's not about what government can do specifically to help poor people and people without health insurance. If you change the agenda and the discussion, you change what people think. It's not a coincidence that if you take a look at the public opinion questions that were asked in late 2009 and early 2010, the nice thing about these polling groups is they ask the same exact question, the same exact wording month after month. So you can track the changes and you know it's the same thing you're talking about. You see a big spike in July and August of 2009. What's going on in July and August of 2009? Death panels and rationing in these town hall meetings. These are the three big themes, and you see a huge spike in public opposition to health care reform during these 2 months. You see a huge dip in opposition after, when you talk about this period of September to October. What's going on in September? In September, Barack Obama finally gets up and makes a pitch for public option. People finally get some sort of information on what liberal healthcare reform would look like. Big surprise, their opposition dips dramatically. You're talking about, in this case, more than a 5 to 10% drop in a month in opposition, which is huge. Usually public opinion doesn't change more than 1 or 2% a month on any given issue. Then public opposition spikes again in January to February 2010. What's going on then? You can count the stories one at a time. You can count them all up. This is when the Tea Party, again, is gaining massive prominence in the rise and the run-up to the passing of healthcare reform between March and April of 2010. And you can see another huge spike in opposition. So these themes, unsustainable cost, death panels, so on and so forth that I've been talking about. These are dominating the message at the same time that public opinion is increasing. How do we know that this is related, again, to opposition to public opinion? Well, we have the general trends that I just talked about, and you can look at specific individuals. That's the nice thing about a lot of these surveys. They actually show that people who paid the most attention to health care reform in late 2009 were the ones who were most likely to oppose health care reform. So there was a relationship. Now you could say, well, maybe conservatives were paying more attention, or Republicans, so that's why there was more opposition. Because sure, if Republicans are paying more attention, they would be more likely to oppose it. No, you can look at statistics. You can control for those things and still find an effect for media. Just paying attention to media made you more likely to oppose health care reform. Now some people might say, well, people were paying more attention, and they were learning about the duplicity and nastiness of the Obama administration and these real death panels and rationing and all these things that were going to happen. It's a hard argument to take seriously because if you look very closely